details.
This is Rogers TV. Call the Rogers TV viewer response line. Email us or connect with us on social media. This is Rogers TV. The opinions expressed in the following programs are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome to another episode of In Conversation with Alethia. I'm your host, Alethia O'Hara-Stephenson. In each episode, I sit down with incredible individuals from our community. These individuals are doing inspiring things. Each episode, you will be empowered, you will be educated, and you will be inspired. In this special episode, I am honored to have the incredible, the brilliant, the beautiful, and talented Dr. Phyllis Pobee. Dr. Pobee is a family medicine physician. She's also a cosmetic medicine physician, as well as a weight loss medicine physician. Welcome to In Conversation with Alethia, Phyllis.
Oh, thank you so much, and thank you for that kind introduction. It's such a pleasure to be here. I can't wait.
Amazing. I'm super excited to have this conversation with you.
Yes.
This is incredible to sit down with you, a Black female physician.
Oh.
How awesome is that?
Oh, you're so kind. It's honestly a dream come true just to do something I've been wanting to do since I was a little girl, and I've never been on TV before, so it's
awesome.
so exciting.
This is amazing. And you know what, we're going to start right into the conversation because you touched on the fact that, you know, this has been a dream of you wanting to be a physician. What inspired you? Was it, you know, most children play with dolls, they've seen someone on TV. What inspired you to want to be a medical doctor?
Oh, that's such a great question. Well, I am the oldest child, and as the oldest, you're always kind of placed in that caregiver role naturally. And I always noticed how family doctors were the touch point of the community. They're that first person that you go to when you're not feeling well. They really become a part of your life and an integral part of your family's life. And I really noticed how they're able to foster and build like health and wellness through building a sense of trust with families. And so I always thought that was the highest level of caregiving and the highest level of, of giving back, and really such a privilege. So it's something I always aspired to be, and I just really feel so honored every day going into work.
I love it. I love the fact that, you know, you were able to connect giving back to the community through medicine, and that's absolutely powerful because how better way can you inspire a community, can you get a community healthy and well than being a doctor? And you provide that full spectrum of health and wellness to the community. What has that experience been like for you?
Well, it really is, in a word, transformational. And I'll probably use that word a lot today because when you deal with the whole aspect of somebody's life, it's nothing short of transformational.
Yes.
When you're dealing with someone's, the socioeconomic factors, you're dealing with mental health issues, you're dealing with physical issues, their chronic issues, even acute issues, you know, to something as like a common cold. Just getting someone back to health and wellness to be able to go to work, take care of their families is really a backbone of society, I think. And it's beneficial in so many ways. So I really think it's a great honor.
I love that. And I want to touch on your journey into wellness and family medicine. When I was doing research for the show, I noticed that there's only, I think, 2.3% of Black physicians in Canada, and the population of the Black community is around 4.5% of the overall population. So for you to be able to tap into that field, what was that experience like? Did you have mentors along the way?
So I had mentors of all backgrounds, and so that is something that prompts me to be a mentor today. All of those mentors were able to guide me on each step of the way. And coming into this field, like you mentioned, there's not a lot of Black females, so I didn't really have mentors in the fact of someone that really looked like me. And so I knew, you know, not having physicians in my family, that I might have some stumbling blocks along the way, not necessarily taking the most perfect steps to get to my final destination. But the most important thing, and what some of my mentors instilled in me, is, you know, not giving up and knowing that if this is something that you want to do, you can do it, and just keep going after it. And that's something that I pursued relentlessly. And so it's something I tell to people that want to go into medicine, that if you want it, you have to kind of want it more than anything else, and you will get it. So
amazing. I'm sure, were there some sacrifices along the way?
So many sacrifices. I mean, you know, while you're a student and you're trying to save up for medical school, there's just little things where, you know, the housing market is a mess now, but I didn't get to buy a house years ago when it was better. So you really are making like financial sacrifices, social sacrifices. You're not going out late with your friends, you're reading and studying. And even sometimes currently, like in my job, I miss the occasional soccer game for my 4-year-old son, right? But all of that is so worth it to me when I, you know, get to follow up with a patient that is feeling better because of a treatment plan that we put together, and that makes it all worthwhile. And it also, touching back to your question about being Black and female in medicine, it is so worthwhile to have that representation.
It is.
And, you know, my patients all have a spot in my heart, but there's just something to coming into a room and it's someone who's young or someone who's female or someone who's Black, and they're like, wow, you're my doctor? And it really helps when they see that representation. I can feel their shoulders come down and they're relaxed and they're able to kind of speak to me freely, and that really is part of that trust and that connection where I can really help them in a level of helping them in their health and wellness in all aspects of their lives.
That is so true, because when I first met you and I heard that you were a medical doctor, I did a little dance of joy, right? Just for the simple fact that you are a young Black female who I can connect with. I know that you are someone who, you know, would understand without me having to say certain words, you know, what the ailments are, what the triggers are, what the conditions are. So I can totally appreciate how your patients feel. So
thank you.
So happy that you're in our community.
Yes, exactly. And it's not only, you know, Black women, or it's sometimes some people will tell me that I identify with you because you know what it's like to be other.
Yes.
And so being able to touch all people that might feel on the fringe of society, and working in rural Ontario is part of, you know, that mandate for me, is just making sure that everyone has that equitable access to care. So
that is so true and so powerful. Everyone has equitable access to care. That should be the tagline for the show.
I love that.
So the theme of our show today is inspiring wellness through generations, or for the next generation. And when I look at your practice overall, you're touching on three distinct, but they're so connected, they're so interrelated: cosmetic medicine, weight loss medicine, family medicine. What was the motivation for you to tap into all three? You could have stopped with just family medicine.
Right, exactly. I feel like a quintessential family medicine doctor in the sense that I have my feet in so many different things, because family doctors, we do a lot.
Yes.
We take care of patients from birth all the way until when they're older with more chronic illnesses. And so that felt like a natural extension for me. I was already dealing with all aspects of a patient's health. But when I went through my own personal journey of, losing 100 pounds,
wow.
That's when I really delved deep into weight loss medicine, because I really understood the complexities of what it took to be successful and the barriers.
Mm-hmm.
And so if someone, a medical professional, could struggle so much with losing weight, how much more so my patients and clients? So I really wanted to kind of bridge that gap and make it easier for people and have them be more successful. And then in terms of cosmetic medicine, I am a girl's girl. I just love it. I love looking good, feeling good, and I love imparting that with my patients and clients. It's one thing to, be healthy, but it's another thing to look good, feel good for yourself. And my mandate is always making my clients look like themselves and the best versions of themselves.
Right.
Another one of my mandates is helping people live fully and joyfully. So if that means, fixing a little asymmetry on their face or fixing some hyperpigmentation, I'll do it.
Love it. And I'm going to tap into the weight loss medicine and family medicine first before we go into cosmetic medicine. So one of the things that I'm hyper conscious of and aware of is the impacts of weight loss, especially on our Black women. And I know it impacts, generally the broader community as well. But when it comes to high blood pressure, diabetes, all directly related to your weight. And so how has that experience been like for you to be able to offer that holistic care to an individual or to individuals, struggling with hypertension and obesity?
It's, again, that word, transformational. It truly is. Weight loss medicine and family medicine, it's really quite synergistic. It's really one and the same in the sense that it's a comprehensive approach. You're really looking at someone's sleep, someone's habits, their genetics, when you want to tackle their weight. And same when you're looking at their health, when you're a family medicine physician. And one of my mentors told me, obesity is the next smoking. We look at smoking and say, it affects all your organ systems. Obesity does the same thing.
Right.
And so I see when my patients are successful, they're able to stop their hypertensive medications. They're able to come off of their diabetes medications. So they're healthier in the sense of, their chronic illnesses from the point of being a family medicine physician. And then, of course, in that weight loss aspect, they're feeling confident. They're even feeling sexy. And that, feel like better parents. They can play with their kids. They feel like better employees. And they feel like they can contribute to society. So it taps into all aspects. And it's really comprehensive is how I want my practice to always be.
I love that. And, especially when you look at the fact that you're taking care of families from a birth right up, through, their entire life. And you're not just looking at it from one aspect, you're providing holistic care.
Exactly.
Right? You're looking at the whole self.
Yeah.
That is absolutely amazing. And when I look at moms especially, if you're able to provide healthy opportunities for mom to be able to thrive and be her best self, that is automatically going to be passed down to her children and her family. So I love that approach. I'm sure you must find it absolutely rewarding.
Definitely. I mean, as a mom myself, my kids are young, 4 and 2. It's sometimes, you feel like if you're taking time to exercise or meal prep, you're taking time away from your kids, but just like you said, if you come back stronger and healthier, you're a better mom there for your kids. And so just reminding, especially new moms of things like that, you got to put your oxygen mask on first before you put on for your kiddos, and just reminding ourselves that you're worth it. You're worthy. Take that time for yourself, and you're going to come back 100% stronger. So that is another one of my mantras. I always like to share that with my patients and clients.
I love it. I love it. And I think of it as revive and thrive, and that is your brand. That is your trademark, right?
Yes, exactly. So that's part of why I created that brand. I love working, one-on-one with my patients, but when I want to provide them with a more comprehensive solution, solution, it's when I'm able to offer them that Revive and Thrive program, which kind of goes into, like I mentioned, all aspects of their health. It's not just about the numbers on the scale,
Yes.
feeling bad about yourself for not eating something or eating something that you felt like you shouldn't. It's understanding the mechanism behind the weight gain. Is it the genetics? Yeah. Is it your blood work? Is it your lack of sleep? Is it your lack of awareness about foods to eat? So it's really taking that one-on-one time to provide results that are sustainable, long-lasting, and
amazing.
Yeah.
On that note, we're going to take a short break. So we'll be right back with In Conversation with Alethia, with my guest, Dr. Phyllis Pobee, talking about healthcare, family medicine, weight loss medicine, and cosmetic medicine. We'll be right back.
Oh, hi there. I'm Mark Grice, the artist, and I'm just preparing another canvas with a sketch on it that I'm going to paint for you in my show called Mark Grice, the Artist. I start out with a photograph in my hand, and in 1 hour I complete a painting right before your eyes. Now I got to get back to work getting it sketched out on the canvas so you can watch the show right here on Rogers TV.
This is Rogers TV.
Welcome back to In Conversation with Alethia. I'm in the studio with Dr. Phyllis Pobee talking about your overall health, wellness. We've got so many things that we want to touch on, and we left the last conversation talking about wellness, and I want to touch on one of the things that we were tapping into, and it's obesity. And you mentioned that it's the next big thing next to smoking, but it's not just something that impacts us right here in Canada. It's a global phenomenon, really.
Correct.
So when you're doing family medicine, what are some of the things that you're using as a strategy to help individuals cope with obesity? And you mentioned you're talking about their medical history and blood and the whole component about it. But how else do you tap into making sure that that individual is able to tackle that chronic condition?
Yeah, so it all comes down to planning. Everything comes down to creating a plan that both of us create together and making sure that it addresses the goals of the patient. Because as their physician, yes, I do have certain goals in terms of their health, but patients have certain goals in terms of maybe how they want to look. Maybe they want to be strong, maybe they want to play with their kids, maybe they want to bring their hemoglobin A1C, which is a marker of diabetes or pre-diabetes, maybe they want to bring that down a little bit. So we'll set a goal, okay, so in 3 months, where do you want to be? So then based upon that goal, then we work backwards. Okay, so if that's your goal, then these are the ways that we can bring your blood sugar down.
Right.
These are the ways that we can bring your cholesterol down. These are the ways that we can bring your dress size down.
Right.
So it's really kind of being focused and making those little goals. So say if you divided your year up into quarters, right? You have 3 months at a time where you can tackle 4 different goals. Imagine where you'd be at the end of the year, right? If you just picked one aspect of your health every 3 months, it leads you back to just being completely transformed. And so that's how I work with my patients, being able to see them, I'll see you in, maybe at the end of the month, and we're going to work towards that 3-month goal. And we just do it in bite-sized pieces and look at everything comprehensively. So we might just tackle their sleep at first.
Wow.
And then the next 3 months, then we'll tackle, their cholesterol, or, stepwise. So it's doable, and then it's sustainable, and everyone feels like a winner because it's something that they're able to stick with. So.
And that's one of the things too that when it comes to weight loss, there's always a trend, our fad diets, right? The quick fixes. And your approach is not about the quick fix. It's about looking at the individual and making sure that you're providing an approach that, one, they can subscribe to, but it's also achievable.
Exactly, that's number one. So when, sometimes people talk to me and they want to ask about my programs, I say, well, we need to chat first, because it really is comprehensive. It's not one size fits all. And even when it comes to workout plans, it can't be one size fits all at all. Sometimes some people can get themselves hurt trying to do, my friend was doing that workout and lost 20 pounds, I'm going to try it too. That might not be the best approach for you. So I really do take that time to provide the comprehensive approach, not one size fits all, and that's what gives people those sustainable results.
That is amazing. And when we look at the overall confidence of that individual, right, whether it's getting down a dress size, whether it's something that you can't physically see, such as getting off your medication, diabetes, whatever it is that you're on, there is something that impacts the individual and their confidence soars, right? And I'm sure there's some stats around it. I don't have those stats off the top of my head, but you see the individual, they're walking differently, they're walking taller, so.
Definitely, exactly. Like I said, all aspects of their life, people will come to me, I'm a better employee, I'm a better wife, I'm a better husband. I'm wearing clothes that I didn't think I'd wear in years. And that just comes back to my mantra, like living life joyfully and fully. Because I think to those patients, like, what if you never lost the weight, right? What if you kept saying next year, and you never became this version of yourself again?
And you missed those opportunities.
You missed those opportunities. And so I say, especially at this point of the year when there's 4 months left, sometimes people will say, well, there's Thanksgiving coming up and Christmas coming up, so I'm just going to, wait till next year. Those are 3 to 4 months that you could have changed your life, right? So don't put off to tomorrow what you can do today.
Start.
Yeah, just start. Just start. Yes, exactly. And I always say it's progress over perfection, right? So those little steps, it might not be perfect. You're going to be so much further ahead than when you wait till when you think you'll be perfect.
Exactly.
Right? So,
wait until the new year.
Yes,
have a New Year's resolution.
Exactly.
Start now.
Just start now.
Yeah. And the other thing that I love about your approach to wellness and weight loss is you're not restricting. You can still enjoy the things that you like in moderation. So I think that's an incentive for individuals who want to take this seriously and take care of their health. Not lose weight, but take care of their health.
Exactly.
I love that. Now, we're going to tap into cosmetic medicine. And before I go into the serious question, we've been talking a lot about women's health.
Right.
What about the men? Men have concerns about weight and they want to look good as well.
Of course. And, for men, it's similar to women. Men want to look back to how they were looking in their 20s.
Absolutely.
And even with cosmetics as well, sometimes getting rid of crow's feet and little lines that kind of show up. So we definitely do Botox, as we call it, for men, and other little subtle changes that you'd say you look refreshed. That's how those are the compliments my clients get. We don't want them to look different or enhanced, but just a little fresher.
I love it. So men, if you are looking at enhancing your overall health, now you know who to call.
Get a Botox.
Botox, I love it. So that word should be in the dictionary.
Yes, maybe it will.
Trademark it. We're going to touch on now mental health and wellness and your overall health. And I first met you at the Third World Diversity Conference earlier this year in Edmonton, where you were a panelist talking about mental health. What are some of the correlation between your overall health and wellness and weight loss and mental health?
So intertwined, it just folds back on itself. When you are struggling with mental health, it makes it difficult in order to be healthy and well. You can overeat, you can undereat. There's binge eating. There's times where you're not even going to have the energy to meal prep and make healthy meals for yourself. And then that can also spiral and make you once you start to gain weight, further have worsened symptoms of depression and anxiety and social anxiety, because you don't want to go out because you feel like you've gained weight. So it really kind of is this snowball effect where if you're not able to kind of get help and get the resources, you can really feel quite stuck and quite trapped. And that's where I see a lot of my clients and patients where it's like, I just don't feel like myself. I don't know how I'm going to get back to myself. And so sometimes it's treating the mental health issues first, but then for some people it's like, no, I need to get back to my original weight, and then that is what helps them deal with some of the mental health problems that they're struggling with.
That's amazing.
Yeah.
And we don't often think about how intertwined it is.
Exactly.
And so I love that you're able to tap into the psychology of, the individual's overall well-being and, what are some of those triggers?
Yes.
I would never have thought about, and that's why you're the expert, right? Would never have thought about, the overeating and, what are some of the triggers that cause individuals to overeat and or undereat. So that's amazing that you're able to provide that care to individuals. Now, again, when it comes to, obesity and mental health, are there certain trends that you're seeing when it comes to obesity and mental health? Or
definitely, I think COVID was a major trigger for a lot of my clients and patients. Like, they felt that they maybe were on a right track, where they were starting to get healthy, and then COVID happened and they were home and they were not going to the gym as much. They weren't getting that interaction with maybe their colleagues that were doing friendly competitions to lose weight, things like that. And then I also noticed how it affected the younger generation, right? Maybe being home, not as active, gaining weight, but then also spending more time on social media, like TikTok and scrolling and comparing themselves to maybe a filtered image of somebody. So this really increased, these pressures and these feelings of depression, anxiety, not knowing how to lose weight, and maybe going into a binge purge eating cycle, and a lot of just eating disorders coming out from trying to change their bodies but not having the skills and the tools to do it properly. So when I do have adolescents come to see me, it's really a totally different approach, right? In terms of handling that, you want to give them the knowledge, but you also want to be careful that these are young minds, very impressionable.
Absolutely.
And I struggled with weight my whole life, losing 100 pounds when I was older.
Amazing. Congrats, by the way.
Thank you so much. But I just remember thinking back to when I was young, I just didn't understand about food at such a young age. And so just being able to break it down and working with the parents, right? So it really is like so many layers in terms of how people are kind of struggling with their weight, their mental health. Parents are trying to help children. Children are kind of wading through it by themselves. So that's another reason why I love family medicine, is to be able to help the entire family. I'm starting to see families, do challenges together, going for, let's go for a 20-minute walk all together, and they're all losing weight together as a family. So that's a huge joy for me.
Amazing, amazing. And I love the fact that you touched on TikTok and some of the trends that we see in social media. And, young people, adolescents often compare themselves to the filtered version, right?
Exactly.
And that by itself is a stressor, it's a trigger.
A huge trigger, because they feel like they need to look like that version on the screen, and they're spending so much time on scrolling that they're losing touch with reality, right? So just that reminder that that's not real, that's a filter. Be you, there's only one version of you. Be that best version of you can be.
Absolutely.
But don't compare yourself to this filter, or even AI, right?
That's a whole other topic of conversation. But no, this is awesome. We're coming towards the end of the show, and I hate to have to end, but before we close, I want to touch on, some inspiration. What were some of the opportunities from a young person starting out in medicine? What were some of the opportunities and advice that you would give to a young girl that's potentially watching this show right now, thinking about going into medicine, on the sidelines? What would you say to her?
I would say, don't be afraid to ask for help. I think sometimes we really underestimate people. People are kind and generous, and because, you know, as a little girl, I was able to ask even some of my doctors or, you know, family friends that knew other doctors just to say, this is a passion of mine. Do you know anyone that can help me? And those are the very people that became my mentors. And so even amongst my colleagues, I can't really think of anyone that would say no to a young girl who wanted to learn more about medicine. So really, I really implore you, if you want this, ask for help. Nobody does it by themselves. No one's on an island. You really, you know, sometimes really need people's help to succeed. So
it's a community.
Yeah, we're a community. So and I work as a mentor, so reach out to me, and sky's the limit.
Absolutely love it. Sky's the limit.
Yes.
Here you have it. We have Dr. Phyllis Pobee talking about weight loss medicine, cosmetic medicine, and of course, family medicine. This has been In Conversation with Alethia. Tune in next time for another amazing episode. Thank you for watching.